Oh, this is a good one. Which technique do you use? That's for the 6 of you. Starts here.
I literally usually use a really small 2mm cannula for harvesting using syringe, and then I go through a stainless steel screen and put it in 1cc syringes.
Oh, okay.
Barry.
Depends if it's a face and smaller volume or large volume for the body. But, you know, we'll harvest, the face ones will spin, the body ones we don't, and nothing else special.
Nothing else. Michael?
Old-fashioned Coleman technique and then micro-injection after centrifuge.
So I can talk to this pretty good. When I first started, I was using those techniques, and I didn't find that the fat viability or sustenance was that much. I would be curious to know what your long-term, or let's say 1-year percentage of fat that remains is there. So now I've switched it over. I was originally doing Vaser fat, and now I'm doing water-assisted. So I do body with PRP. I do body jet with PRP in the fat, and I get close to 80-85% at 1 year. It's hard to quantify the number, but most of the buttock and fat that I do, I'm following the sizes and seeing how long it lasts. And I don't manipulate it at all, so I'm not really doing any inversions or centrifugation. It's just right out of it, the water gets suctioned, and it's immediately drawn into syringes and then re-injected. And I find that you get really good results. And there's a lot of new studies out now looking at water-assisted and Vaser ultrasound fat, comparing to standard techniques, showing a much higher rate of viability.
How do we know the PRP? Did we do a control study with one side
You know,
PRP and one side no?
I've done that, actually. There's no real good publications on that, but I've done breasts and buttock half, followed people for like a year in my practice. I did about 10 or 12 people that way. And my opinion was that the side that PRP was treated, that PRP was added, sustained a little bit more.
What'd you measure it with?
It's just size. It's just based on the sizing.
I think a lot of PRP, and we've got to see more control studies. Because we're using it everywhere, and I think we're going to look into a study with hair transplant, because we can count hairs. It's easy to quantify.
You know, and when I learned in New York from Patricia Wexler, she, freezes and stores fat, but in California where I work now, you can't because you have to be a tissue bank to do it. So she's able to continue doing monthly injections to do touch-ups and things. I'm not able to do that in California, so I do as much as I can, overfill a little bit, and then follow the patients over time. And if I need to redo more, I would do more later. So that's kind of how I would be able to.
Corey,
Can I just mention something very quickly? I find it fascinating that we freeze fat to destroy it and make somebody skinnier, but then we also take the fat and freeze it to store it so that we can inject it later.
Yeah.
Excellent comment.
Excellent. Corey, tell us what you like.
I use a 3mm basket handle cannula, and we do a very wet technique with lots of tumescence. And we don't centrifuge, we don't manipulate, we let the fat separate in syringes, and are careful to get all the serous material out. It's pretty standard.
Jason.
So if you ask me, you're going to hear last year's stuff. So if you really want to learn about this, go see any talk by Dan Del Vecchio at this meeting. He really is up on some of the newer stuff that they're doing with this. So.